I'd like to welcome to the Open Mike program Mary Moulton, Executive Director of the Washington County Mental Health Services. Good morning, Mary.
Good morning, Mike. How are you this morning?
I am fine. Let's start out with a general question. Let's keep it at the 30,000-foot level, and then we'll go into each service that you do provide. But
Sure.
What types of services does Washington County Mental Health provide, and the reasons why?
Well, we're what's called a designated agency, Mike. So we're available to the entire community to call at any point in time if a person feels that they're having a mental health crisis. And we have several divisions. So we have divisions that help adults if they need therapy. Or they want to come in and talk about a problem, and we help them to determine whether they need to see a therapist. We also have programs that are for people with serious mental illness, and we assist them by wrapping around services that help them with housing, case management, transportation, psychiatry, nursing, a number of programs like that. And we also serve the children's side of the house with families. So people within our community that are struggling with family situations, with children who they feel are having challenges in school that might be related to a mental health issue will call us. And when it gets really bad, we have an emergency services team that responds to all of that. So that's a 24/7 a hotline that we provide. We do outreach through mobile crisis. We're able to go out and talk to people, help find out where they could be best served within this very broad agency for which we employ, by the way, 750 people in our community. And then we have the developmental services side of the house, where we help people who have intellectual disabilities. So we serve about 4,000 people, and when you count family members and other community members that we reach out to, probably about 7,000 total.
Let's start where you just left off, developmental services. What type of services are we talking about there?
So people have to meet criteria, and we actually serve only about 30% of the entire population of Vermont through our services that have a developmental or intellectual disability. So a person who needs assistance there may have a problem with housing. We can look for a home provider for them. We have 100 people in our community that actually open up their homes and take home and become a home provider. So they provide transportation. They get people to doctor's appointments. They help them to become more independent and have more of a sense of what we call self-determination. And one thing I've been impressed with in the years that I've been involved, I've been at Washington County for 30 years, is watching people really come into themselves, because our services have provided them with the opportunity to work. Over 40% of the people we serve in developmental services go out and work every day. And just help them to to receive supports and have social relationships that make their lives rich.
I want to talk about crisis services in a minute, but I was fascinated by sort of how you broke down your groupings, because they sort of talk about the needs out there. Let's talk about children, youth, and families. What's involved in children, youth, and families, and what services do you provide there?
So that's a big division where we serve over 1,000. And we have a spectrum. So we have actually supports in every school in Washington County through what we call a behavior interventionist for children who are having struggles getting through the day. And they might not fit into that school structure. And if they've had trauma in their lives, they're not able to make it in a regular classroom. So we have supports in the school, and if they really are not able to do that, then we have a school. And we serve kids that are from preschool, elementary, all the way through high school. Our goal is to get them back to their school with their behavior interventionist. But I've talked to kids in the school system and our school system, and they say that when they come over, they're able to have that flexibility. They actually have to work to earn certain privileges that they're really proud of when they get there, and we just help them to stabilize some of their behaviors. And so with that, hopefully we get them back to their school system. So that's a school. We have a daycare for kids who have been determined to have significant trauma in their family lives. We have a full early childhood program, and we work with children with autism in that program as well. Working out in the community with families, helping with teaching life skills, parenting skills to our families with kids that they're trying to raise and hold on to is all part of what we do, in addition to working with all our community partners like DCF, doctors' offices. So Children's is kind of a cooking place every day. It's busy, busy, busy. And if you ever go into our school, you'll hear how busy it is.
Let's talk about adult mental health. What sort of services do you provide in that area?
Well, we have two big divisions there, and one is for people with what's termed severe mental illness. And so folks who have been hospitalized and are really struggling with a diagnosis of perhaps schizophrenia, bipolar disorder, depression, can receive a number of services that I mentioned earlier around case management and helping them find housing, helping them get out to the grocery store, organize their lives a bit, and make sure that we're doing everything that we can to help them to have the best quality life that they want. And we talk about recovery. Recovery is really important. We used to think of mental illness and think, that's a dead-end street. Not at all. We talk about recovery, and I see people whose lives have changed dramatically because of the supports they receive, not just from us, but from friends and peers that have gone through it. We all have mental health issues. And so on the other side of the house, we have our therapy. That's all blended in, and we really want to just get the message out, and I say this all the time, it's like beating a drum, that mental health is health. And we've come from a place where we used to just talk about those folks that came out of hospitals, but mental health is all of us, and we all have to tend to this part of ourselves.
We're speaking with Mary Moulton, Executive Director of the Washington County Mental Health Services. I want to combine two things. It's crisis services and a much broader discussion about the state of our mental health system here in the state. There's been a lot of talk about the state of our mental health system here in the state. And one of the sort of discussions is what happens when somebody calls in crisis. Where do they go? Where do they stay? Some of our emergency rooms, for example, are overcrowded with various mental health issues. Let's talk first about the services you provide with crisis services, and then talk about sort of the state of the state of mental health.
That's a good way to break it down. I appreciate that. So we have a 24/7 hotline, as I mentioned. We take over 15,000 calls a year on that hotline just in Washington County, believe it or not. So we have a mobile crisis team, but that team is the team that also answers that phone. Anyone can call. Doesn't matter the age, and the person on the other line is a clinician who talks to the caller, tries to determine what level of crisis they might be having, and we let people name that. So it might be, I'm having, anxiety, and I don't know why. This is the first time I've ever experienced this. And so we talk to them and perhaps work to get them an appointment within our organization. Then there are those on the other side of the spectrum that might call and feel really suicidal. And so we want to try to assess with them what they need and whether we should see them in the emergency room. And we make arrangements to do that. And then we also go out and we do what we call roll with the police or just by ourselves for the most part. 60% of the time the team goes out on its own and goes to homes, goes to schools, goes to courts, goes to the street, goes wherever they need to go in order to respond to that mental health crisis. We work closely with law enforcement on this. We're trained together on this, developed that training together over really 50 years since we've been working on emergency services in Washington County. And so that's one part of that spectrum. And then If you end up in the emergency room and you need hospitalization, we get into what we are hearing in the state as the mental health crisis. And that has a lot to do with upstream services, too. We're an underfunded system, so there's more we can do upstream if we had the staff to do it. But we have experienced an increase in numbers over this past couple of years. We've experienced an increase in acuity, in the level of crisis being higher, which we attribute in part to our substance abuse issues. Definitely seeing a higher percentage of substance abuse interwoven with the mental health issues when people come in, and they can't always find a hospital bed. So they're sitting in emergency rooms.
Do we need more beds?
Well, that's a really good question, and nobody's answering it right at the moment. But it's definitely being looked at by the Department of Mental Health to assess if we need more beds, what kind of beds do we need? So as I understand it right now, not just from my team, who is seeing more referrals, for example, from the courts to hospital, because a judge can send someone to the hospital for an evaluation, and they end up in the emergency room now. They used to go to the hospital, but there's not a hospital beds. They end up in the emergency room. Emergency room's holding all these people. Could be in our hospital at CVMC 3 or 4 on any given day. So we, have to wait through a process to see when a bed comes. And it may be that there's a discussion around forensic beds and whether we should have a separate unit on that. That's part of what we'll hear during this legislative session.
Let's get back to the specific services of your organization. How do people access your various services?
So we have a line that people can call for mental health services. That is our single point of contact, which is 229-0591. That's been the same number for 50 years. And so we that's also our emergency line. People calling into that number, and they can indicate what their issues are. We'll do a telephone intake with them. We have a person there who can talk to them about what their needs might be. And again, given all the services I described, then we're going to try to help plug them in. We have a special children's, what we call navigation section. So if families call with multiple issues with kids or with their families, we'll talk to them and try to plug them in as well. And then we get calls, again, from doctors. We get calls from DCF. We get calls from school systems, and they might be concerned about children or adults. And we take those on a regular basis, those calls, and we're working with multiple providers on any given day to see how we get people into this kind of underfunded system where we're still trying to get more staff in the door every day. So.
We're speaking with Mary Moulton, Executive Director of the Washington County Mental Health Services. If you have a question, a comment, give us a call at 802-244-1777, toll free at 877-291-8255. I want to go back to the fact that this is your 50th year anniversary at Washington County. It's Washington. I'm not saying you are the 50 years there, but I'm saying
it's close.
I'm saying that Washington County Mental Health Services, they're celebrating their 50th year anniversary. Can you tell us a little bit about the history?
Sure. We had a wonderful celebration in September, and there have been 2 executive directors prior to me, Roger Strauss, who lives over in Moortown, and Paul Dupre out in Barrie. So, we started back in 1967, and at that point in time, we had 200 clients. We're in the thousands now. We worked to deinstitutionalize, and that was about bringing people from the state hospital out into our community. And that was a very important project that went on, and our communities overall have been incredibly welcoming. But it's a constant need to educate. It's a constant need to integrate people who have special needs and into our community as regular citizens. So that's the work we've been doing over 50 years. And in We've now know the hospital washed away in 2011, so we have a decentralized system. On the developmental services side, we closed the Brandon Training School in 1993, and Washington County Mental Health took the last patient client out of the Brandon Training School. So that was an important moment for us to have had that incredible moment of seeing that institution close. And we continue to work on that integration. When you think about people with developmental services and intellectual disabilities and how we have them in our communities as friends, and we need to have more community development. We have to have more community integration and response, and I love to talk about that with our communities. And as part of our 50th, went around to a few communities and talked about mental health issues and had a real rich conversation about how we can have healthy communities, which is now where I think we're moving.
I picked up a couple of things that you said. Underfunded was a couple of times you said that. How are you funded?
So we're funded through, for Washington County Mental Health and most of the designated agencies throughout the state, primarily Medicaid, because we serve those who are living in states of poverty. And so 90% of the people who we serve are on Medicaid. So those are our dollars. And we do that through a grant process with the state as a contractor. And so Washington County Mental Health Services, in effect, a state arm. And however, we are not state workers. We're a private nonprofit organization.
And the problem is that the Medicaid reimbursement doesn't cover the cost. Is that the problem?
It doesn't cover the rates. And so, what we have experienced in our Medicaid increases is the inability to keep up with, say, the competition in the marketplace for what you pay staff. So we have hospitals that may be able to hire a therapist right across the lot from us for $20,000 more. So it makes it very hard to keep staff, and we see a constant churn and turnover. But after we have people stay with us for 3 years, many stay, and so we're glad about that part of it. We have a huge churn in the first few years, but we have such a great organization. People do love working for us. It's just a matter of being able to put food on the table.
You've been there for 30 years. You're also the Deputy Commissioner of Mental Health. You were the Commissioner as well. I'm always curious about people and the reasons why they pick their professions. Why did you go into this area?
Well, in the 1980s, I'll date myself a little bit here, but probably along my fifth or sixth job, I started working at the Kirby House right here in Waterbury, known as the Waterbury Inn. And I happened to be working, actually doing a little lobbying up at the legislature, and someone asked me if I would manage the Kirby House while the owner actually, while she was leaving the area. And I went and did it, and I fell in love with working with people who had mental health challenges. And I think it probably took me back to some of my early days. We all have these issues in our lives, and it felt like home. The next thing I knew, I'd met the emergency services folks at Washington County, and they had a job opening, and there I was. So,
as you're looking forward, what's the greatest challenge to your organization?
I think pressures for the needs in our community and how we use our dollars. We're doing more health integration. We need to get more about mental health into our primary care offices. We have a number of projects that we're doing with Central Vermont Medical Center and with our primary care offices now. So what our greatest challenge is going to be is how we use the dollars and move the dollars. We know there are not a lot of new dollars. So my mantra is then we need to shift and be very efficient and smart about the use of our dollars as a system. And when I say mental health means health, I mean that means look at the healthcare system and should dollars move.
Let's talk about your greatest reward. What do you see in this profession that you're in, that you've been in for 30 years? What's the reward out of this?
It's the people. You know, I love people, number one, but I think for my staff, seeing people that we work with every day find enjoyment in their life, to be able to get back on their feet. Mental illness can be devastating and can take the wind out of your sails, and so that's called life, and helping people get back on track with their life, and having some fulfillment in that is, and working with my staff that are incredible people, dedicated and passionate. That's what keeps me there, and I think that's what keeps them there.
If somebody wanted to get a hold of your organization, the Washington County Mental Health Services, where would they go?
Again, I think the best place to call is our central number, which is 229-0591. And they can also just look us up on WCMHS.org. We have a website. There's a lot of information there on jobs. There's a lot of information there on services and phone numbers to call. Everybody seems to work electronically these days, so WCMHS.org is a good place to go.
Mary Moulton, thank you very much for joining us today.
Thanks so much, Mike, for having me.